Gentleman yields back. Recognize Dr. Schrier. 5 minutes.
Thank you, Mr. Chairman. And thank you to all the witnesses for convening here and being squished at that table today to discuss all of the emerging issues facing your respective centers of disease and control and prevention centers and specific offices. I wanted to start just by thanking Dr. Arwardi for being here today. She's a fellow pediatrician, leads the CDC's National Center for Injury Prevention and Control, which collects data and funds research at 9 injury control centers across the country, including the University of Washington in my state, close to my district, at Harborview. Accidental injuries are the leading cause of death among children, including vehicle safety and drowning, and gun injuries. So ensuring fiscal year 25 funding continues for this particular research is critical. My question is going to go to Dr. Dimitri Daskalakis. Last week, CDC confirmed the first H5N1 influenza infections in poultry workers. That's in addition to the dairy farmers since 2022. This particularly, or could be particularly important in my district where the Wilcox eggs that we all purchase at Costco come from if they were ever to be hit by avian flu. So my question to you is, while the CDC still believes that the risk to humans is low, what would prompt a change in that assessment? How would any change be communicated to the public? And then if there were human-to-human transmission, because I'm remembering this from when my child was a baby, how close are we to developing, scaling up production of, and distributing a new H5N1 vaccine that could prevent transmission of this variant?
Thank you so much for that question. So I'll start by just highlighting how important our core capabilities at CDC are to allow me to actually answer that question. So the work that we do in the laboratory and the data analytics really allows us to have visibility into what's happening with this virus and how it's interacting with human health. So we work very closely with our USDA colleagues, but we have both systems through our local health departments to monitor individuals who have been exposed to this infection, and then also through our laboratories to identify any changes that we see in the virus. So that place where epidemiology touches the lab ends up being a critical piece of the core capabilities that we use. We have these overlapping systems so that we can monitor what's happening with that virus, but it's also the system that we use to look at seasonal flu and what actually leads to the second part of your question. So our seasonal influenza surveillance is what allows us to identify what's circulating in the community. And that also tells us how to better develop seasonal vaccines, but also how to develop vaccines for more urgent or emergent pathogens. So as an example, there are 2 candidate vaccine viruses that exist today because of this system that allow us to have them sort of available in the event that we do need to scale up. This is also a great point of collaboration with agencies. So we work really closely with our ASPR colleagues who really are focused on the development and the next steps in preparedness to be able to have vaccine available in the event that we see any changes in the epidemiology or virology related to that flu. So again, all of those systems come together. We are in a preparedness stance and really moving toward, again, better understanding what's happening in that important view.
I just have to interrupt you for a sec because I want to get to my next question. But just for the record, if you could submit in writing, first of all, how do you detect that if we only screen for flu during flu season, and this might not be seasonal? And second, whether you think the mRNA vaccine or the model vaccines we already have would be the jumping off point. That could be in writing. I want to just get in a quick question to Dr. Hacker about cigarette smoking and tobacco exposure. So cigarette smoking itself has trended down among our nation's teenagers. However, nearly 1 in 4 high schoolers still use tobacco products. As a pediatrician, I'm really concerned about the widespread use of e-cigarettes, which hook them and then later turn them into cigarette smokers, perhaps, and then vaping products, because we don't know what is in that liquid and how that could hurt the lungs. And these have flooded our schools and, of course, gotten kids re-hooked on nicotine. I was wondering if you could comment about that in 10 seconds, the work you're doing and what we can expect, and you can do that in writing.
Absolutely. Well, first of all, we share your concern, and we track this very carefully with our our tobacco survey that we do annually, and we work very closely with FDA as well. We now have a campaign to empower youth to quit smoking or to stop from the beginning and never to start, to really give out the information that I think is so critical to being able to make sure people understand exactly the kinds of things that you raised.
Thank you. I'm talking with my son about it. Yield back.
Gentlelady yields back.